Lecture 12, Skull and Vertebral Column, continued. We will start back with the skull, with the sphenoid bone. Now, it's not as obvious externally as the other bones of the skull, but it is an extremely important bone in stabilizing all of the other major bones of the skull and critical portions of the brain. It is shaped like a butterfly or bat with wings extended. Here we can see a superior view looking down at the surface. The sphenoid bone is going to border on the temporal bone, occipital, and frontal bones, with the ethmoid bone being at the very front. And here are some of the landmarks that we'll start with. First will be the sella turcica, otherwise known as the Turkish saddle. It is a saddle-shaped depression in primates and supports and protects the pituitary gland. Tumors of the pituitary gland are often restricted by this bony structure, and so they grow cranially and compress the optic nerve, causing partial blindness. The other structure that we can see here is the foramen lacerum. The foramen lacerum is a triangular hole or passage of several arteries, veins, and nerves, including the carotid artery. The sides are comprised of both the temporal, occipital, and sphenoid bones together. Here we can see an access point directly into the sphenoid sinus. The sphenoid sinus is going to sit on the anterior portion of the sphenoid and make up the border between the front and back portions of it, and then border on the nasal conchae. The sphenoid sinus is two sinuses of varying size, separated from the nasal cavity by a thin shell of bone. An interesting fact is that this sphenoid sinus permits surgeons relative easy access to pituitary gland tumors by going straight up through the nose. As can be seen here, the surgeon would be going up through, piercing that bone structure, and have access to the pituitary gland. The next bone that we'll be talking about will be the ethmoid bone. The ethmoid bone is from the Greek for sieve. It separates the nasal cavity from the brain and contributes to the orbit of the eye. It is comprised of three parts: the cribriform plate, ethmoidal labyrinth or lateral masses, and the perpendicular plate. We can see the ethmoid bone as it is anterior to the sphenoid bone, here in green. Looking even closer, we can see the ethmoid bone as well as some of its organization and the nasal conchae. The nasal conchae are going to be scroll-like extensions of the ethmoid in the nasal cavity, and it warms, moistens, and filters the air. It comes in the ethmoid has the superior and middle nasal conchae, whereas the inferior is going to make up a portion of the maxillary bone. Here we can see another good view of the ethmoid bone, including the cribriform plate, caristogali, the middle nasal conchae, and perpendicular plate and lateral masses. The cribriform plate up top is going to be have numerous holes that are perforated, and this allows the olfactory nerve to extend through. A thin plate projects upwards from the cribriform plate, and this is called the caristogali. Moving down to the middle nasal conchae, we've talked about the nasal conchae being those scroll-like extensions that extend off to the side and allow air to warm, moisten, and become more turbulent. Then at the very bottom, we have the perpendicular plate. This is a thin, flattened bone descending from beneath the cribriform plate and helps form the internal nasal septum. It articulates with the frontal bone, nasal bones, and vomer. So this is going to make up the back part of your nasal septum that separates the right and left nostrils. The lateral masses themselves are going to be a collection of thin-walled cavities in the ethmoid containing the ethmoid sinuses. They function very similar to the conchae to warm, moisten, and filter air. They also contribute to the tonal quality of the voice. It's what gives my voice resonance here, whereas if I
Close off the actual sinus passageways, I have less resonance in my voice.
Here we can see another view of the ethmoid, caristogali, and cribriform plate in combination with the entire skull. The olfactory nerves, either bulb, will sit on top of the cribriform plate. Looking in the back portion, we can see a few other structures as we start to make a nice frontal cross-section of the actual skull. We can see where the septum and perpendicular plate are connected directly lower to the vomer. Notice the green as it connects into the light pink color. Here we have a few other bones to take note of. The zygomatic bone. This is going to be paired bones that contribute to the cheekbone and serve as an attachment point for various facial and masticatory muscles. They articulate with the maxilla, frontal, temporal, and sphenoid bones. We also, of course, have the lacrimal bone. The lacrimal bone contains the lacrimal fossa, which permits the passage of ducts from the lacrimal gland to the eye. This is what would collect tears. Here we have the maxilla bone. It's actually a pair of bones that fuse during development to form the upper oral cavity and the opening of the nasal cavity. We can see the alveolar processes that extend off, as well as the margin. And this is going to be a thick ridge of bone containing tooth sockets and serves as the attachment site for the buccinator muscles. We also have the infraorbital foramen. This is a passageway that allows for arteries, veins, and nerves to extend out to the face. And then the zygomatic process that would extend off from there. And the zygomatic process is simply going to be the process that allows it to connect directly to the zygomatic bone and be part of the cheekbones. Now, the back portion of the maxilla is actually going to be the palatine bone, as can see here. The palatine bone is a pair of roughly L-shaped bones comprised of a perpendicular plate and a horizontal plate. Together with the palatine process of the maxilla, it comprises the roof of the mouth and makes up the hard palate. This contributes as well to the floor of the eye orbit and the nasal cavity. Here we can see an isolation of the vomer. The vomer is a single bone located at the mid-sagittal line of the skull. It articulates with the left and right palatines, maxillary, and sphenoid and ethmoid bones. It looks actually like a shark fin when removed and is sometimes linked with some of the inferior nasal conchae, but it's going to be a single bone by itself. It contributes to the bony septum of the nose, and an interesting fact is this is the location of the vomer nasal organ in many animals, such as cats, to detect pheromones using a behavior called the Fleming's response. Moving to the lower portion of the skull, we have the only synovial joint inside the skull, and that's actually going to be between the mandible and then the temporal bones. But here's the mandible. It's the lower jaw bone that results from the fusion of two separate bones during development and can be effectively divided into two portions. The horizontal body, as can be seen in the lower portion, and then the two vertical rami. A rami, or singular ramus, is actually going to be an arm-like structure that bends and extends upwards. In this case, the ramus is going to end in the condylar process and the coronoid process. The condylar process, or mandibular condyle, is also called the mandibular head and articulates with the mandibular fossa of the temporal bone, comprising the temporomandibular joint. The coronoid process itself is going to be an insertion site for the powerful temporalis muscle and forms one of the interlocking mechanisms of the temporomandibular joint. The last thing to note is that there is, of course, the alveolar processes here for where teeth are going to insert. This bone is the only bone of the body that actually doesn't articulate with any other bones directly. It's just connected via muscles, and that is the hyoid bone. The hyoid bone is a small bone located in the front, or the laryngopharynx region of the throat, and is the attachment site for multiple muscles that are involved in swallowing as well as vocal production. It consists of a medial body flanked by lateral projections. Here we can see a thick articular capsule, and it is surrounded by several ligaments that stabilize the joint, but the joint remains relatively loose and permits a range of motion not usually seen in hinge joints, so it's unique in that respect. And these are the ligaments you will need to know. The lateral ligament, also called the temporomandibular ligament, is going to connect from the temporal bone into the mandibular. And we can see that here. It stabilizes the lateral surface of the temporomandibular joint. The next will be the stylomandibular ligament. The stylomandibular ligament is going to connect from the styloid process of the skull into the underside of the mandible. This is an extracapsular ligament that extends from the styloid process to a posterior edge of the mandibular angle and helps stabilize it from moving too far laterally. The sphenomandibular ligament is going to connect from the sphenoid bone to the actual mandible, and it is an extracapsular ligament that is going to help stabilize again during that side-to-side movement. Inferior to the skull are the column of vertebral bones. The vertebral column consists of 26 bones with 24 vertebrae plus the sacrum and coccyx. This forms a characteristically curved structure. Now there are 4 spinal curves that we'll talk about. There's the cervical, thoracic, lumbar, and sacral. The cervical itself is going to have more of a lordotic type curvature, as well as the lumbar does. Thoracic and sacral will be more kyphotic. It's simply the direction that these bend. Now, as far as how many there are in each, there are 7 cervical vertebrae, 12 thoracic, and 5 lumbar. Easy way to remember is breakfast, lunch, and dinner. 7, 12, and 5. Now, when looking at a normal spine, we of course have some natural lordotic and kyphotic curvature. However, in some cases, this can of course push too far and will have exaggerated curvatures. If we have an exaggerated kyphotic curvature of the thoracic spine, this is called kyphosis, and it is often known as hunchback. This is usually due to osteoporosis, congenital defects, muscular dystrophy, and some other factors. It can cause difficulty breathing in severe cases. On the flip side, we have lordosis, or a hyperlordosis. This is characterized by a hyper-exaggerated lumbar curvature and is abnormally large. It results in an abnormally large convex curve that occurs due to tight hip flexors oftentimes, poor posture, as well as pregnancy. The final curvature we'll look at is going to be scoliosis. Scoliosis is a lateral curvature of the spine. It can occur in the thoracic, the lumbar, thoracolumbar, or throughout the entire spine in multiple locations. This is going to be a general view of a vertebrae. The vertebrae has a few different structures that we want to take note of. First is going to be the body. The body is actually where the intervertebral disc will rest on and is going to be the main weight-bearing structure of the vertebrae. As you go deeper down into the vertebrae, further down the lumbar, they get thicker. When you go further up into the cervical, the bodies are smaller. Pedicles connect the body to the rest of the structures on the outside, with a transverse process extending from either side of the vertebrae, making sure that it has an attachment site for different ligaments. From there, we have the articular processes, both the superior and inferior articular process, that is going to allow the vertebrae to articulate with the next vertebrae above and below it. Extending off the back, we of course have the spinous process. The spinous process is going to be almost like a dorsal fin on the vertebrae and allow different ligaments to connect together to unify the structure. This is going to be a sample cervical vertebrae. Now, there are a few things that separate cervical vertebrae from the rest of them. First and foremost, it has a very small body and a small general structure. Cervical vertebrae are always smaller than the rest of the thoracic or lumbar vertebrae. They also have transverse foramen. Transverse foramen are going to be a site for nerves and blood vessels to go through. There is, of course, the vertebral foramen throughout the cervical vertebrae, but they exist in all vertebrae. The final point that's a little bit different is going to be the bifid tip of the spinous process, and this is simply to allow for more ligaments to attach. Now, the cervical vertebrae, as I said before, go through C1 through C7. The previous slide, you saw a sample cervical vertebrae. That would represent C3 through C7. Our first two vertebrae, C1 and C2, are a little different and highly specialized. Here we can see the C1 or atlas vertebrae, where it articulates with C2 axis. The atlas articulates with the axis to allow for movement of the head and neck. and it's stabilized. The atlas is stabilized via the transverse ligament across a structure unique to the axis called the dens. It is an extension up from the back of where the spinous process would normally be. Now, there are no bodies on the atlas and axis. They are simply a transverse bone structure that is going to extend down. So the first cervical body is actually going to start on C3. Moving down into the spine, we have the thoracic vertebrae. The thoracic vertebrae are going to have a slightly larger body than the cervical. They're going to be a heart-shaped overall structure. And then we have very large transverse processes with a transverse costal facet. These facets are going to allow for the articulation of ribs with the thoracic vertebrae. From the lowest section, we have the lumbar vertebrae. Here, the body is much, much larger, and the bone structures, pedicles connecting the body to the rest of the vertebral column structures are much larger and thicker. This, of course, is designed to deal with a lot more weight on the actual vertebrae being applied. So once we put all of the vertebrae together, we separate each vertebrae with an intervertebral disc. This consists of an end plate, annulus fibrosus, and the nucleus pulposus. This is going to be a fibrocartilage disc that will maintain itself. It can, of course, increase in size as fluid goes up or decrease in size as body fluid goes down. So that means you're at the tallest that you are every morning once the body actually has a chance to elongate. Now, there are different ligaments that are going to connect and stabilize the spine. We can see a few of these here. We can see the anterior longitudinal ligament, the posterior longitudinal ligament, ligamentum flavum, and the intervertebral discs and nuchal ligament that will connect those together. All of these are simply going to stabilize the vertebral column during movement in different directions. Here's a closer look at an actual intervertebral disc with the different annulus fibrosus covering the nucleus pulposus. Now, in some cases, we might actually rupture this. If we rupture, we have what we call a bulging disc, and this puts pressure directly on the nerves of the vertebral column and causes us a great deal of pain. Now, there's no exact cure for this, and a lot of times you usually simply go through physical therapy to try and strengthen the muscles around it and open up the capsule. The only other way would be to actually remove the disc and fuse the spinal column together. Here we can see a normal spinal cord with a massive disc herniation at L4, L5 that's protruding out and pushing into the spinal cord. Extending down from the vertebral column, we have a few other bones left. We have the sacrum and the coccyx. The sacrum is going to be a fusion of 5 sacral vertebrae, a synostis, into a single structure. The fusion starts after puberty and finishes between ages 25 to 30. It articulates with L5 and the coccyx and the pelvic girdle. It provides an attachment site for many muscles, including those involved in the movement of the femur. So it's going to be the one that actually articulates directly with the ilium and the coccyx bones, and the coxal bones. And the spinal cord passes through the sacral canal to the hiatus, and the several spinal nerves pass laterally through the sacral foramina. The coccyx is our vestigial tailbone and is a fusion of 3 to 5 bones. It is an attachment site for muscles that control the different openings of the anus.